So I'm going to be the nurse today. How are you?
I'm doing well.
Okay. Today is September 18, 2025, and I will be evaluating a physical assessment on you today. Okay?
Okay.
All right, perfect. I'm going to do some hand hygiene. Wash my hands with soap or water or use some hand sanitizer. Hand is washed. All right, perfect. And I'm going to go ahead and assess for ABCs. So obviously the patient is, airway is not obstructed, so airway is clear. Breathing, I'm going to check for a natural rise and fall and make sure the chest is symmetrical, which it is. And I'm just going to check the radial pulse just for some circulation. Okay, good ABCs. All right, so we are going to be doing a physical assessment on you today, and we're going to go ahead and close this curtain to give us some privacy, okay?
Okay.
Okay. Are you in any pain right now?
No.
Okay. All right, if I can rate your pain, if you have any out of 0 to 10, what would you rate it?
Say 0.
Okay, perfect. All right, do you have any symptoms pertaining to or connected to why you're here?
No.
No, no symptoms? Okay, perfect. And if you can go ahead and state your first and last name.
First name, John. Last name, Williams.
Date of birth.
It's going to be January 15th, 1999.
Okay, and do you know who the president is?
Yes, Donald Trump.
And what year are we in?
In 2025.
Okay, and patient is alert and oriented ×3, and speech is clear. Okay, what else? Patient is alert and oriented ×3. Okay, so from here we are going to go ahead and let's see, vitals. So I'm going to go ahead and obtain vitals for the patient. So I'm going to go ahead and place a blood pressure cuff on the patient's arm. I'm going to make sure there's no fistula in that arm. We're going to make sure there's no IVs in that arm. We're going to make sure there's no wristband on that patient's arm. We're going to watch out for any notes hanging on the walls or above the bed stating to not obtain a blood pressure on a specific arm. You want to be aware and alert for these notes. So I will be obtaining a blood pressure on the patient's arm because I am allowed to do so because there is nothing visually in the way of doing so. So I would be performing a blood pressure, making sure the patient's feet are flat on the ground. We will be making sure that the blood pressure is within normal range. 120/80 is the normal range for blood pressure. We will also be checking for a heart rate. The heart rate range is 60 to 100. And we will also be obtaining a temperature sublingually and making sure that it is not higher than 99.6. We will also be checking for oxygen saturation, making sure that that is in normal range as well. So anything below 93 or anything above 93 is fine within normal limits. Okay. So then we will be doing lung sounds right now for the patient. So I'm going to go ahead and start that. Okay. So we're going to start anteriorly. Breathe in, please. I listened to all the lung fields. There was 12 in the front anteriorly and 8 in the back posteriorly. They are clear, they are unlabored. Patient is not using any accessory muscles to breathe, no nasal flaring, and everything is within normal limits. Okay, so from here, we're gonna go ahead and we are going to listen to the bowel sounds. And for this purpose, we will just be doing it with the gown for patient privacy, as we were stated in our rubric. But we would not want to overclothing so that there's not any muffling or anything that gets in the way of listening to the bowel sounds properly. So there's 4 quadrants, so we're gonna listen to them carefully. Vowel sounds are normal active in all 4 quadrants, and just for correction purpose, I will be inspecting the bowel, the abdomen first, and then we'll be palpating to check for any hardness or to just check to see if it's soft. And after we palpate, then we will go ahead and we would auscultate. And as the findings came back, the bowel sounds were normal active. So that was just a correction for the abdomen part. From there, we're gonna go ahead and we're gonna listen to the apical pulse for 1 full minute. For this purpose, for the purpose of the video, the apical pulse was performed for 1 full minute, and the range is within 60 to 100, and the rate was normal, the rhythm was normal, and that was it for the apical pulse. From there, we are going to go ahead and we are going to check all of the pulses. So I'm going to start off with the carotid pulse. And we want to make sure we're not checking them both at the same time. So the carotid pulse is bounding. I would essentially be performing the same to the other side as well. I'm going to go ahead and I'm going to check the radial pulse. Radial pulse is bounding. I'm going to go ahead and check the brachial pulse. Radial pulse is good and bounding. Okay. I'm going to go ahead and check for sensation on the patient's extremities. Do you feel that?
Yes, I do.
Okay. Do you feel that?
Yes, I do.
Okay. I'm also going to check for range of motions on the upper extremities and make sure the patient has good motion. So if you can do some range of motion. Okay. Bend your arms. Open your toes and spin your wrists. Alright. The size, there's no swelling on either arms, there's no edema. The color is good. It's good color. Alright, we're gonna check for skin turgor. So usually we just check for skin turgor on here. There was no tinting present, and you could also check for skin turgor at the clavicle as well. And we usually do that for older patients. And there was no tinting for the skin turgor assessment. Alright. Okay, from there, we're gonna go ahead and check the pulses at the not bottom of the foot, for the lower extremities. If you can have your feet flat on the ground for me, please. Thank you. So we're gonna check for the pedal pulses, which is known as the dorsalis pedis on top of the foot here. Those are bounding, and I'm also gonna check for the posterior tibialis. There we go. I'm gonna check for those. It is bounding, and I will go ahead and check for any sensation. Do you feel that?
Yes, I do.
Okay. Do you feel that?
Yes, I do.
Okay, and in some cases the patient is laying on the bed. I will do it under the patient's foot and make sure that the patient is responding to the stimuli. All right, if you can extend your legs for me, check for some motion. Okay, twist, but move your ankles. Do it with the other foot. Okay, perfect. There's no signs of edema. I will palpate to check to see if there's any pitting. For any pitting edema, there is none present. Okay. What else? I will be checking for any wounds if the patient has any, and you want to check the date on the dressing to see if the patient has any dressings. If the date is outdated, you want to obviously change the dressing. You want to check the saturation and check the characteristics of the drainage so that you can note in the patient's chart. Let's see. What else? When was your last bowel movement, sir?
About 2 hours ago.
Okay, and how was your bowels? Was it normal?
It was normal.
Okay, and what about voiding? Are you having any issues with voiding?
No, I'm not.
No? Okay, is your urine clear? Does it have any foul smells or anything of that nature?
Yes, it's clear.
It's
No
clear,
foul
no foul smells. Okay, perfect. All right. From here, I'm gonna go ahead and do a neural check on the patient and check the patient's pupils, okay? So as far as a neural check, can you smile for me? Okay, smile is symmetrical. There's no drooping on the left or right side of the patient's face. Can you stick out your tongue for me? All right, perfect. All right, you're all set. Okay, you're good. And I will also ask the patient to stand to make sure there's no limping or there's no drooping on one side of the body, just to check to see if the patient maybe would have had some type of stroke. But from what I see and from what I've assessed, the patient's neuro is intact. We're gonna go ahead and check for pupil. All right. All right. Can you look at this pen for me, sir? Without moving your face, but just following with your eyes, okay? 1, 2, 3, 4, 5, 6. Okay, perfect. Just look straight ahead and don't follow the light. Okay. Pupils are equal, round, reactive to light, and they accommodate. So pupils are great. What else? Just gonna check to, mentally check to see if I'm missing anything before I end my assessment. That's all I have for the assessment. Thank you.